Calvin, do you have any? Do you understand? Do you have any trouble understanding people when they speak?
No.
Any earache? Any ear pain? Okay, so now I'm going to palpate your ears. Do you feel any pain?
No.
Any tenderness?
Nope.
No? Okay. How about your, so do you ever experience nosebleeds? Any discharge? Do you have, are you used to having sinus infection, sinus pain? Okay. Do you have excessive sneezing? Excessive watery eyes?
No.
Do you have any throat discomfort? Okay, so I'm going to palpate the sinuses and let me know if you feel any pressure or any pain, discomfort. Anything? Nope. Okay. Do you have any pain when you eat, when you talk, anything in your mouth? If you can stick out your tongue. Okay, towards me. Say ah. Again. Okay, great. The roof of the mouth looks good. So if you can stick out your tongue now and move it side to side. Awesome. And now I'm going to, again, touch you. I'm going to palpate your lymph nodes. Okay, perfect. Are you ticklish?
Mm-hmm.
Is there something that would make you feel better? No. Okay. I got a ticklish one. Okay, your lymph nodes seem good. So now I'm going to palpate the trachea. I'm going to...
I'm so sorry.
It's okay.
Go. I got it.
So now I'm going to palpate the trachea. Okay. And can you swallow for me? Good. I don't feel anything. Okay. So now, Miss Galvin, you said you don't do any tobacco. Do you smoke?
No.
Do you have consistent coughing?
No.
Pain in the chest area, lungs?
No.
And you said you do you exercise much? I mean, aside from your dad's?
A little sometimes.
Any difficult breathing?
No.
Okay. So now I'm going to auscultate your lungs. If it's okay, is it okay if I put the stethoscope under your shirt?
Mm-hmm.
Okay.
It's probably cold.
Can you breathe for me? Okay, breathe. Again. Okay. Take a deep breath. Perfect. And now let's look at. I'll palpate the front. You can put it on. Okay. So now the same thing with the front. Just keep breathing.
Keep going.
Okay. Sit up straight. If you can sit up straight for me. Okay. Thank you. Perfect. So do you do any breast self-examination?
Yes.
How often?
Like once a month.
Once a month? Okay. Do you experience have you noticed any masses, any pain?
No.
Any discharge?
No.
No? So, how about your heart? Have you experienced any chest pains recently? Ever?
No.
Does your family have any history of cardiac problems?
No.
How about high cholesterol?
No.
Okay. So now is it okay if I listen to your heart? Okay. And now I'm going to listen to the aortic, followed by the pulmonary, then the tricuspid, and lastly the mitral valves. Okay. Okay, if you can sit up straight with for me. And if you can move right here. Perfect. So I know you mentioned that you try to eat healthy. How is your appetite? Is it usually, are you usually hungry?
It's normal.
Normal, and what is considered normal?
I eat when I'm hungry, which is like 3 times a day, so I eat 3 times a day.
Okay, how about your stool when you use the bathroom? How can you characterize it for me?
Hard.
Okay, hard. Do you have any pain when using the bathroom?
No.
Okay. And how often do you ever feel a sense of urgency into going to pee, for example?
No, unless I drink a lot of water.
Okay. Can you usually hold it? Like if you need to, you can hold it. Okay. So when was your last menstrual period?
A month ago.
And and how long does it usually last?
A week.
A week. And is it usually a regular period?
It's regular.
Okay. And by regular, I mean it happens once a month, every 28 days. Do you ever experience lots of pain? No? Okay. So do you have, is it okay to ask you about your sexual partners? Sure. Okay. Have you had any sexual partners? No? Okay. How about, is it okay if I ask you about your genitalia?
Sure.
Do you experience any discharge from your vagina?
No.
Any lesions?
No.
Any swelling?
No.
Absolutely any pain?
No.
Okay. So now, experience any joint swelling?
No.
And by joints, I mean like where? Yes, exactly. So do you I know you said you exercise with your desk, so when you're bending and everything, do you experience any activity restrictions in any of those areas? No. Okay. So I'm going to ask you to squeeze my hands. Squeeze, squeeze, squeeze. Awesome. Can you put your hands out? Okay. And can you try to move my hands? Okay. And now, okay, perfect. Now do the same. Try to push them down. Perfect. Okay. So now we're going to do the same with legs. If you can put your legs straight. There you go. I'm going to actually go to your level. Okay. If you can push your legs up. Awesome. And now push your legs down. Okay, great. Okay. How about now that we're looking at your legs, can you flex your foot up, point up towards the ceiling, point down towards the floor. Okay. And how about we do it again with keeping it in the same position, up and down, up again, and all around. Great. How about the next one? Up, down, all around. Perfect. So, do you experience any dizziness?
No.
Have you had any seizures at all?
No.
Any tremors?
No.
Speech? Do you have difficulty speaking?
No.
Okay. So now for our last assessment, if you can please stand. Let me get this out of your way. Okay. And if you can please stand right here, right beside me. And walk towards the window with your hands to your side. Okay, walk back. And one more time, but now heels to toes. Heels to toes. Okay, perfect. And if you can just stand there and close your eyes. And just stand there and close your eyes. Okay, so no movement back and forth, which is good. Balance is there. Okay, so now you can sit down. So lastly, do you have any history of Alzheimer's?
No.
Dementia?
No.
Do you have trouble sleeping?
No.
Do you experience anxiety?
No.
No? Okay, so yeah. Are you ready for the 4th of July this weekend?
Yeah.
What day is it today?
It is Wednesday.
Awesome. And let's see, who was the last president?
Obama.
Obama. Okay, great. So yes, Ms. Galvin, this is it. Thank you so much.
Thank you.